Employee shortages across the medical community are being felt in healthcare systems around the country. Locally, hospitals and clinics say they're doing what they can to meet the needs of the community while leveraging a decreasing supply of workers. News 19's Joe Minnie has the details.
Prior to the pandemic, the medical workforce struggled to keep up with the rising demand for healthcare. COVID has only added to that struggle.
The last 2 years have absolutely changed the environment of our workforce.
Fewer young adults are choosing medical occupations, and those that do are facing medicine that wasn't in their textbooks.
What's happening is these poor students are coming out of graduation. They're not prepared to see what they're seeing. It's a very different healthcare environment. Our patients are more ill than they've ever been.
And the dwindling supply of new workers is adding to the growing departure of older ones.
Between that first surge last fall and this current surge that we're in, if people were close to retirement or maybe on the fence of whether they were going to retire, they retired.
Baby boomers requiring greater medical services while the same generation is leaving the workforce is creating a silver tsunami of demand.
That workforce of the past is not going to come back. We are going to have to be creative. We're going to have to figure out how to do things a little bit differently.
The challenges health systems are facing aren't deterring their commitment to medical care.
So they are doing anything and everything to make sure they have the healthcare workforce necessary to meet their community's needs.
We still are running a vaccine clinic. We're still testing. We've got many people that are stepping up and performing duties outside of what they were hired to do.
With fewer people, it's still business as usual in an unusual circumstance. In La Crosse, I'm Joe Minnie, News 19.
Now, to combat the slow replenishment of workers, healthcare systems like Gunderson say they're working with colleges and universities to promote new medical students, while the Wisconsin Hospital Association is trying to streamline the certification process through legislation.